Welcome to Health ABCs. Today we will be talking about asthma. This talk is created by medical students solely for the purpose of patient education. This video does not replace going to see your doctor and should not be used as medical advice. If your child is having a medical emergency, call 911. What is asthma? Asthma is a condition where airways in the lungs become narrow and inflamed. This makes it difficult for your child to breathe. This is also a condition that can run in families. So, if a parent has asthma, their child may be at increased risk. Asthma is known as an atopic condition. Other atopic conditions include eczema and allergic rhinitis. If your child has one of these conditions, they may be more likely to develop asthma. What are the common symptoms of asthma? Some common symptoms of asthma include coughing, wheezing, chest tightness, and shortness of breath. It is important to note that these symptoms are not exclusive to asthma. That is, other medical conditions can present with similar symptoms. If your child is experiencing these symptoms, they should see their doctor. If a child is having trouble breathing, this is a medical emergency, and you should seek immediate medical attention. If you think your child may have asthma, you should bring them to see their doctor. If a pediatrician thinks your child may have asthma, they will want to know the answers to a few questions to help with diagnosis, including, what symptoms is your child experiencing? How often are they experiencing these symptoms? Do your child's symptoms ever wake them up at night? Do they ever prevent your child from going to school or playing with their friends? Do you know what triggers their symptoms or what makes their symptoms worse, such as when they have a cold or when they are exercising? Are there any pets that live in your home? Is there carpet in your home, mold, cockroaches, or mice? Does anyone in the home smoke cigarettes inside or outside the home? Does anything make their symptoms feel better, such as taking any medication or resting? Has anyone in your family been diagnosed with asthma? In order to diagnose someone with asthma, the doctor will also perform breathing tests to see how your child's lungs are working. The type of asthma your child has will depend on how often they are experiencing symptoms and the severity of their symptoms. Common treatments. If your child is diagnosed with asthma by their doctor, your doctor can create an asthma action plan explaining the different treatments prescribed for your child. There are different types of medications used for different reasons. Quick relief medications are medications used when the child is currently experiencing symptoms of asthma and is in need of quick relief. These medications can be given using a metered-dose inhaler or by nebulizer. When an inhaler is used, a spacer is given with it to help the medication reach where it needs to in the lungs. One example of this type of medication is albuterol. Long-term controller medications are medications that would be taken every single day in order to prevent your child from experiencing symptoms in the first place. Not every child with asthma needs to take this type of medication. Whether or not someone needs to take this type of medication depends on how often they experience symptoms and how severe those symptoms are. For example, if your child is diagnosed with intermittent asthma, they may only be prescribed one medication for quick relief when needed. If they are diagnosed with mild, moderate, or severe persistent asthma, however, they may also be prescribed a long-term controller medication in addition to their quick relief medication. Once your child receives a treatment plan from their doctor, it is important that they take their medications as prescribed. In other words, if a medication is prescribed to be taken every day, then the medication should be taken every single day, even if your child is not experiencing any symptoms at that time. It is also important to figure out what things make your child's symptoms worse. These are called triggers. Common triggers include exercise, change in temperature or weather, change in seasons, emotions, allergens such as pets, pollen, and dust mites, cigarette smoke, and getting sick with a cold or the flu. Here are some online resources that can be helpful for parents with children with asthma. For more information, speak to your doctor. Thank you for watching this video about asthma.